Do you ever get heartburn? Do you ever get reflux or discomfort or a burning sensation after you eat? Well, if you do, you're not alone. 1 in 5 Americans will get similar symptoms in any given month. And it's important to recognize what this means, when to be alarmed, when to talk to your doctor, and what treatments you can do starting today, even without needing medications, to start improving your symptoms. I'm Dr. Ryan Bober from AskYourMD, and today we're going to dive into gastroesophageal reflux disease, or GERD. So let's get started. The most common symptoms that you experience with reflux, or GERD, are typically a burning sensation in your chest after eating. It's not associated with exercise or activity, and it can get worse if you lay down quickly after having a meal. It should not feel like a pressure, and you might have a metallic or an acid taste in your mouth. And also, some people can get a hoarse voice in the morning if they're having reflux symptoms at night. Nausea, sometimes a sensation of a lump being stuck in their throat can also accompany reflux and GERD. Now let's go through some alarm symptoms that if you're having, you should talk to your provider before trying any of the general treatments that I'm going to describe. If you have new symptoms and you are over 60 years old, if you have blood in your stool, black tarry stools, or vomiting with blood, unexplained weight loss, difficulty swallowing or pain with swallowing, persistent vomiting, a first-degree relative with a history of a gastrointestinal cancer, or chest pressure, worsening symptoms with activity, or a history of heart disease, you should talk to your doctor first before just empirically treating. Once you reviewed the alarm symptoms and made sure that you don't have any of those, and you've talked to your doctor if you do, then you can start doing some of these lifestyle changes that can start improving your symptoms starting today. These include cutting back on things that make your reflux worse. This includes tobacco smoking, alcohol, fatty fried foods, larger meals, laying down within 2 or 3 hours sometimes of your meal, limiting the amount of caffeine, limiting the amount of peppermint, chocolate, and spicy foods can also help improve your reflux symptoms. And pay attention to which foods tend to make your reflux worse, and try eliminating those or reducing those one by one. The other 2 important features that you can start doing are raising the head of your bed, and you can do this by putting styrofoam wedges or other blocks underneath the head of your bed. Even 6 to 8 inches will make an improvement of your symptoms just by gravity. And then weight loss, and this says it's easier to say than complete, but I will be making some videos on how to more effectively lose weight in a safe way, but just know that weight loss will improve reflux symptoms as well. So now let's move on to therapies that you can find in your pharmacy that can help improve your symptoms. For something as a medication to help relieve your symptoms quickly, even though you're already trying these lifestyle modifications, you can start with an antacid. Examples include calcium carbonate, or Tums, aluminum hydroxide with magnesium hydroxide, or Malox, sodium bicarbonate with aspirin and citric acid, or Alka-Seltzer, and a variety of other combinations. These medications work within about 5 minutes, and they last for 30 to 60 minutes. It's okay to try if you have mild symptoms, but don't take too many of these because the magnesium may cause diarrhea and the calcium can cause electrolyte changes. The next class of medications, if your symptoms are slightly more intense than the antacids can help with, then you can take something called an H2 receptor antagonist. Examples include famotidine or Pepcid, cimetidine or Tagamet. These have a slower onset, but they do last longer. You start these as needed before a meal if you have mild or moderate symptoms. Do not take these with antacids because they are not absorbed as well. And if it's not working, then you can try to use these twice a day for 2 weeks to check if these medications will help or not. Ranitidine has been recalled, but the other medications are safe to take. The final medication class that is useful for people with consistent and persistent symptoms, despite trying the medications like famotidine and cimetidine and the antacids and the lifestyle changes, are proton pump inhibitors, or PPIs. Examples include omeprazole or Prilosec, pantoprazole or Protonix, and esomeprazole or Nexium. These are the strongest options available, and you want to start with the lowest dose possible, typically 20 milligrams, and take these on an empty stomach without antacids 30 minutes before a meal. These medications are generally safe, but you should speak with your doctor if you have any concerns about side effects, or if you have persistent symptoms despite the above trials of medications. So I hope this was interesting and helpful to you. Now you have a framework of what the reflux symptoms that you're having can be related to, when you have alarm symptoms and what to do about them, how lifestyle modifications including raising the head of the bed, some weight loss, avoiding or cutting back on spicy foods, fatty foods, chocolate, peppermint, alcohol, smoking, and as well as how to pick your therapies from the pharmacy, including antacids, cimetidine, and famotidine, and then your PPI classes, and how these can effectively help improve your GERD symptoms. Thanks again for coming by. I'm Ryan from AskYourMD. Let me know if you have any questions and comment below, and subscribe if you like any of the content. I'll see you next time.